So moving forward, preceptor will ask you to present the patient. Jake's an 18-year-old male football player new to college. He's presenting with diffuse abdominal pain. He has a positive Ravsing sign, right lower quadrant tenderness. So moving on the rest of the case, and probably the most important, is really deciding on differentials. So everything we've gathered is kind of leading us up to this moment. So our number one diagnosis, in my opinion, and hopefully yours, would be appendicitis. So we're ruling out and in appendicitis. So what studies do we want to provide for this patient? Always basic labs, right? We want CBC, CMP, lipase to rule in or out that pancreatitis, urinalysis to rule in or out any type of urinary process. And then depending on the ultrasound, we can also do a CT of the abdomen. So the next part is we're going to review our orders. So we see an elevated white count, we see an elevated C-reactive protein, and then our urinalysis looks negative. So really, what are we thinking here? Our original differential of appendicitis is pretty good. It's pretty solid. So we're going to move on here to the CT and abdomen pelvis report. And so we can see that the appendix is dilated, and good news for our patient here, there's no evidence of perforation. So move forward here into the management. We're probably going to consult general surgery and recommend for admission. Place him an NPO, and what often comes along with NPO, we will sometimes see dehydration, low sugar, low glucose, so we want to get him on start IV fluids. So it looks like here we have managed our patient, and then moving forward, not only does Sketchy Cases give you a full walkthrough of a patient from start to finish, but it really allows you to practice board-style questions as well. So which of the following antibiotic regimens would be the most appropriate for initial management of Jake's appendicitis? So we're going to get him started on those antibiotics. And we know ceftriaxone and Flagyl. Moving below, you can see one of our sketchy sketches, which is great. So if you don't have sketchy NP, you should hop on that train too. Antibiotics are hard. Sketchy NP is so helpful, really helping those antibiotic coverage stick. So we have the course of care. He did have the pain control, IV fluids, and antibiotics that we decided on. And then he's moving forward with the appendectomy, and then, of course, his post-op care.